Hi, everybody. Pamela here. Just want to do a video on frequently asked questions. So, of course, I get a number of questions when I'm talking to people on the phone when they're calling to inquire about our services at Recovery Solutions. So, I thought I'd just do a quick video. Hopefully, it's quick on some of the most popular questions. Where are we located? We're located in Mount Dora, Florida. That's about 50 to 55 minutes northwest of Orlando. We're in a small town and it's very safe for our participants. So we're not in a large city, so we don't have some of the safety issues that we might have if we were in a larger city. So we love the location that we're in because it's a beautiful location. It's more of a country setting. I don't know that country is the appropriate word, but it certainly is not urban. Our patients allowed to smoke? So this is a tough question, right? So the answer is yes. We have designated smoke areas at both of our office facilities and at our residences. So we just ask that participants smoke in the designated areas and at designated times. We are a healthcare facility. We are a wellness program. So for participants who are interested in helping to stop smoking, our doctor and our nurses can help you with that. But yes, at our facility, smoking is allowed. How much does treatment cost? So it really depends on the length of stay, what the purpose of your treatment stay is, what levels of care. So for those types of conversations, I prefer that we get on a call and we can talk about your unique interests and your unique program that you would be asking and inquiring about. So please, at the end of this video, please give us your email address and I can send you more information, or use the link to schedule a 15-minute consultation. It's all free and we can talk about your own personal financial needs and situation. How long is the treatment program? So we are a wellness program, and wellness happens for everyone on an individual case-by-case basis. It really depends on what your circumstances are that are bringing you in. Are you substance use disordered? Are you mental health disordered? Are you co-occurring? What's the length of time that you've been using, or what's the depth of your depression or anxiety or any other mental health. So that again is on an individualized basis. So what I do ask for, and please don't misinterpret this, we are not a 30-day program. Our participants usually stay with us for 90 to 120 days, but that's utilizing the continuum of care. You don't have to stay at the highest level of care for all of that duration. But like I said, we're not a 30-day program, but I do ask for a 30-day commitment. And I'm going to commit to you for 30 days, and I'm going to ask you to commit to us for 30 days so that we can at least get your treatment and your recovery identity started, and we have a good opportunity to get to some good core issues and to develop some good coping skills within that first 30 days. But again, we're a wellness program. We don't measure wellness by the date on the calendar. So hopefully that answers your question. And if you need more information about that and how you could determine what's going to be your particular length of stay or your loved one's particular length of stay, again, send us the email, your email address, get on the Calendly link, and let's get on a 15-minute phone consultation, and we can talk about your specific needs. How many participants do we serve? So we're a smaller program. I like it that way. My professional, licensed, master's level therapists have the ability to really perform individualized, customized care for you and your loved one, and they really can give, a lot more in-depth therapeutic services as we keep our center small. So the answer is we work with about 12 participants in-house, and then we have some intensive outpatient and some outpatient participants who live in the community and come back and forth. So about 12 patients are inpatient, and then we utilize our continuum of care to offer services to a number of other people. What kind of activities do we participate in our program? So we like to introduce or reintroduce our participants to a number of clean and sober activities. Often our participants have separated themselves from family functions, from social functions, and have stopped really participating in those types of activities. So we're going to build into our program some opportunities for our participants to socialize, to be able to experience some of those activities that possibly their mood or substance use disorder have prevented them in participating in. So what are some of those activities? So at the supportive housing, we have some kayaks that participants are able to use. We have some fishing poles. We live right on a beautiful lake, so it's easy to just take the kayak out or do some fishing in the morning before you come over, or in the evening when the program is completed. We take our participants to the movies if it's raining out, and this all happens on the weekends. We might take a walk downtown Mount Dora so that they can see the beautiful little city that we live close to. And there's lots of lakes around, so sometimes we do some water sports, like going out on a water tour, or just hanging out down at the Mount Dora Park is one of the favorites. We do some meditation and walking around and seeing the gators and the turtles and the fish and things like that. We might take them to putt-putt, we might take them to a 12-step function, a picnic, swimming, something like that. So it really depends on what our participants' likes and dislikes are, but we really every weekend try to put them in some type of an activity so that they have the opportunity to see that they can participate in social activities without being under the influence of a substance. And what is the daily program? So the daily program is pretty intense. We wake up at 7 o'clock in the morning over at our supportive living house, and that's all supervised 24/7, 24 hours a day, 7 days a week. And we really encourage that our participants come to the beginning of their day in a quiet, peaceful, serene environment. We believe that that really carries over into their therapeutic work that they're going to do once they get into the clinical building. And they have a couple of hours to get themselves ready, have their coffee, smoke their cigarettes if they smoke, do some meditation readings, and then they're going to be escorted over to the clinical buildings where we get started with our daily program, where they're going to be in there's what we call solutions group. After that, we go into primary group or process group. That's where they're really going to be talking about the things that brought them to treatment, the difficulties that they have, developing some coping skills, and talking about grief and loss, any traumatic experiences that they had. That's really their in-depth processing group. They then have lunch and they go into expressive therapy, where they're going to be having some time to work on their assignments. We are a very assignment-driven facility, so our patients have something to work on every single day that they're in treatment. So we give them a little bit of time to work on some of those, because once the clinical day is done, they have after hours scheduled, and we keep them pretty busy then too. After the expressive therapy group, they have a psychoeducation group where we're going to be teaching them about a number of things. And that can range from family dynamics to anger management, stress management, effective coping skills, life skills, nutrition, exercise, how all of these things affect them, mind, body, and spirit. After they're finished with their clinical day, they have an after hours schedule, as I talked about. On Mondays, Wednesdays, and Saturdays, we take them to the gym, and every day they attend a 12-step fellowship, either Alcoholics Anonymous or Narcotics Anonymous. On Thursdays, we take them grocery shopping so that they can pick out some food that they like to eat and have the ability to cook for themselves. On Fridays, we take them to their meetings. On Saturdays, we do a group process in the morning, or we take them to an outside group. And then in the afternoons, we usually use that time to do one of those activities that I spoke about earlier. And then on Sundays, depending on our participants, we either choose to go to the gym or go to church. So that's our weekly schedule. We keep them very busy. We keep them, filled up with assignments so that they're working on themselves the whole time that they're here. But we also put some free time in there. They live in a house where it really is like their own house. They have washer, dryer, refrigerator, the ability to cook for themselves. They have some nice space to be able to put their own things, and closet space and things like that. So we're really happy about the location that we have. We're really in a very safe environment. Our house is very peaceful and serene, and we really encourage the atmosphere of recovery, and we teach our participants what that atmosphere of recovery feels like, so that way when they're finished with their treatment, they can take all of that back to the environment in which they live. So those are the most popular frequently asked questions. If you have any further questions, please, by all means, send me your email so that way I can provide you with some additional information about our programs and services, or use the Calendly link and get on a call with me, a 15-minute free consultation, and I can always talk about your own specific questions and unique needs. So thanks for being with me today, and have a wonderful rest of your day.